And we do find the eating pattern per se, the different diets that we discuss now, we find that Mediterranean diets have an impact on HbA1c, triglycerides, and cardiovascular diseases. Low carbohydrate diet or very low carbohydrate diet has an impact on HbA1c reduction in weight, improving HDL, reducing triglycerides, CVD, and lowering their blood pressure also. So the way you plan the diet with a low fat, low carbohydrate, encouraging lean meat compared to red meat is the crux of the whole story. So reduced carbohydrate intake reduces circulating insulin, leading to reduction in liver fat, helps to lose weight, reduces pancreas fat, and reduces insulin resistance and increases insulin secretion also. This is the cycle which leads to reversing type 2 diabetes. So whenever you have patients who come to you with initial diabetes, the first 1 to 5 years is crucial. And if in case they are overweight or obese, encourage them to follow a low carbohydrate, high fiber, that is nothing but more of vegetables, and low carb fruits in the diet with a lot of whole grains in portion controlled component. Portion control is a very important component that has to be advocated whenever we talk about carbohydrate restriction. And this is a quick reference for the carbohydrate prescription. Whenever you talk about 1200 calorie, it can be, if it is whatever from studies, if you look at what they claim is around 50% of the diet should be from carbohydrate. That has a good impact. So 1200 calorie, 150 grams of carbs works pretty well for patients in weight reduction. Don't go to extremes of 10% carb or 20% carb. Stay between 40 to 50% carb, which is much safer, because sustenance of diet is very, very important. It is not for few days or few weeks you're going to make your patient do the diet, right? It's going to be a lifestyle change. So for his life, he has to tweak the diet. So it has to be between 50 to around 40 to 55% should stay quite comfortable for them. And these are the guidelines. Current guidelines support the use of low carbohydrate diets as an alternate to standard low fat, low calorie counting advice for suitable patients with obesity or type 2 diabetes. In patients on multiple medications or insulin, or with multiple dietary restrictions and other comorbidities such as renal disease, low carbohydrate diet should be supported by an experienced healthcare professional and a specialist dietitian who can facilitate optimal nutritional intake, because no one size will fit everybody. You have to understand their values, preferences, because adherence to diet is very, very important. As I discussed, long term, you have to look forward. It is not for 1 or 2 days or 1 or 2 weeks. So it has to be tweeted or personalized according to their requirement and then advice, for which doctors have to refer their patients to the dietitians in order to do this. To conclude, clinical practice guidelines have begun to move away from reductionist one-size-fits-all model to a focus on quality over quantity and dietary pattern over single nutrients, allowing for flexibility in macronutrient distribution, range, and greater choice. Comprehensive dietary pattern that combines the advantage of different foods like low glycemic index food, Mediterranean, Nordic, vegetarian, DASH diet results in clinically meaningful improvement in risk factors and associated cardiovascular benefits that is comparable to that seen with medications. And physicians, with the assistance of registered dietitians wherever possible, have an important opportunity to have an impact in prescribing diet and exercise to their patients. When we look at practice applications, use food and dietary pattern-based strategies like Mediterranean, Nordic, vegetarian DASH diets to modify cardiovascular or cardiometabolic risk factors and reduce disease risk as a first line of therapy, especially patients who are obese. This should be the first line of therapy. And on weight reduction, we do find a great change in their metabolic profile. To achieve the greatest benefits in those who are already getting treated with medication, the food and dietary pattern-based strategies is an add-on therapy. Mandatory, it has to go hand in hand with medication. Help your patient to choose the dietary pattern that best aligns with their values, preferences, and treatment goal to ensure the greatest adherence over a long period of time. And consider referring your patient to the registered dietitians for a support in achieving their goals. Thank you for your patient listening.